Governor Walker has declared this Thursday Healthcare Decisions Day in Wisconsin.
Part of an effort to get people to plan for their health care in case they one day can't.
And joining us tonight, Karen Smith, clinical ethicist for Wheaton Franciscan Healthcare. Thanks for coming in. And we were just chatting about how a lot of people don't know about this. What do we need to do now to plan for the future?
Well, the most important thing you need to do is think about who you would want to make healthcare decisions for you if you are unable to make them for yourself. And it's really important for everybody to have this discussion.
So
meaning no matter what the age is, sorry.
That's all right.
No matter what the age is. And in the state of Wisconsin, the only way to ensure that the person you have had discussions with, that you want to make your medical decisions, is by completing a valid advance directive. We have no state lineage, so it doesn't automatically go to your spouse or your parent or your siblings or your children. It needs to go to the person that you assign it to.
So what are the top 3 things that you tell somebody when they start thinking about planning for their health care, maybe end-of-life type decisions?
Right. First of all, it's important that it's your choice, that you think about who really is the person, not that thinks they ought to be your agent, but the person that you know will talk with you and follow your directions on what you would like to have done. Second, is completing the advance directive form is only one part of it. You need to actually have those discussions and discuss your values with them. Would you like to be on life support? What about dialysis? What about a feeding tube? So think through some of those scenarios. And the third thing is that this isn't just a one and done sort of document. You need to periodically review your advance directive. Whenever your health situation changes, maybe you get a new diagnosis. If your life situation changes, maybe now you're young, unmarried, 22 years old, but when you get married, you want to think about it, maybe again when you have children, when you retire. So you need to think about it as things change, if your health status changes, or if your primary agent moves to Africa or moves away.
So there's an open house this Thursday. Tell us what that's about. How's it going to help people?
Well, we're really excited both at our St. Francis Hospital and at our Franklin Hospital for Wheaton Franciscan. We're having an open house with social workers, chaplains, ethicists, and attorneys. So people could come in, ask all of their questions, and actually complete an advance directive. It's free to complete one. You just need 2 witnesses and make sure that you sign in front of them. And if you need more information, if you can't make it to our open house, you could always find us on mywheaton.org.
We were talking earlier about the impact of age on this decision, and talk to us a little bit about younger people and older people.
You know, I really encourage parents, when your kids go off to college, that's an inherently dangerous time period. And a lot of times our adult children don't consider the ramifications. Having this discussion with them does 2 things. 1, it allows you to find out what their thoughts are, and 2, it allows them to think a little bit more seriously about becoming an adult and how their actions have consequences.
So starting early is definitely a must.
I start at age 18, and then again, revise and make changes about every 5 years and whenever your life situation changes.
Good points all along.
Karen Smith, thank you. Wheaton Franciscan Healthcare. Thanks for joining us. The Advance Directive Open House once again Thursday from 10 to 2 at Wheaton Franciscan, St. Francis, and Franklin Hospitals. And we do have more information on our website, tmj4.com/Wisconsin tonight.